Professor Dr. Tamara Lah-Turnšek, thank you for being with us on the Health Channel. Let's cut straight to the point. How are cannabinoids currently being used in cancer treatment?
Oh, that's a very complex question.
It is.
Because cannabinoids are a group of different formulations of these organic molecules which are obtained from a cannabis plant. So you can have more or less different kind of cannabinoids, mostly THC and CBD. THC and CBD and also CBG have been tested recently. But also there are so many cancers, different types of cancer, so they progress in a different way. So it's complex and it varies from cancer to cancer and formulations that are used.
But it's safe to say that they are being used and utilized very well recently.
Yes, that's a lot of increasing number of publications, quite a lot. And we are trying to understand the process, and at the same time, we have to know that there are different goals. Mm-hmm. First, use of cannabis is, which is quite often quite popular. It's a palliative care, palliative medicine, because cancer patients that do not respond to therapies are really in a bad shape, a lot of pain and so on, and cannabis are used instead of opioids. Mm-hmm. And they have indeed reduced the opioid use, especially in the United States.
Uh-huh. So they're most effective, would you say, in treating pain?
Yeah.
Or
here it's no doubt that they are active, and also they do not have side effects as opioids and other painkillers. Then the other thing is chemotherapy-induced invasion and chemotherapy-induced nausea and vomiting. And so here the cannabis is successfully used instead of antiemetic. Antiemetics are pills again, besides effects to stop the bad feelings of the patients.
Yeah, but that's palliative care, but for sure it's been used also with, even before that. And which type of cancers have shown the most promise in this research? Yeah,
so promise means that they stop one or other processes in stepwise cancer progression. Mm-hmm. So it can stop already in proliferation, already in invasion or angiogenesis or metastasis. So these are different responses, or as we call it, endpoints. Mm-hmm. The last one is, of course, and most important, is survival. So they should increase the survival of cancer patients. They would not eliminate, they are not cure for cancer to eliminate the tumor tissue, but along with many other substances that are used also for therapy, because they are never used alone. We always use standard therapy in addition. So cannabinoids are not a primary treatment, but a secondary, additional. And here there's quite a success in one or two endpoints that have been measured.
That brings me to the food supplements, because if it's an additional treatment, and we have so many food supplements based on cannabinoids, does it make sense for people to, reach for these food supplements and help themselves if they are not being treated?
Yes, they can help themselves, but they don't know how. Actually, it's very demanding to, and you have to know what kind of cannabinoids in what measure and in what combinations. Mm-hmm. So as you mentioned, yes, they are more successful, more effective if they are also with other cannabinoids or other terpenes, flavonoids, as they are in nature, in the flower of cannabis. And this is actually really more effective than molecules, even synthetic molecules of CBD and THC.
But there are positive effects on food supplements as well, right?
Yeah, for sure. And these are all the effects. For example, one that I can mention is inflammation, because chronic inflammation is one of the reasons for cancer to develop, especially in older patients. So in older patients, it is really great to keep chronic inflammation down so that cancer cannot develop due to these different molecules that are released from inflamed tissues. So yes, and also along with other immunosuppressant, CBD is immunosuppressant, can be used.
Would you say, I'm just curious being now, that it's better to go on a prescribed diet or microdose every day for a longer period of time? Is there a study?
No, it's not a study, but in any case, longer period is
more effective.
It's more effective than a shot of diet or something. Which
Yeah. Are there any other maybe clinical trials involving cannabinoids that you can share with us lately being done with positive results?
Yeah, one of the most popular at the moment is a really good study on chemotherapy-induced nausea. Nausea and also bad feelings, dizziness, and so on. And here they can help a lot. And this was nearly 100% effect, so very successful. But in terms of increasing survival, there is not so many studies. There actually are, but then another study shows the opposite results. And so there are not enough studies that would show the same results. For example, prolong the patient's survival of, let's say, glioblastoma patients. But we can with more better designed clinical studies, better organized research, we can, this must go through 𝐓𝐚𝐽. So 𝐓𝐚𝐽 measurements are Association of Oncologists in the United States. This is association that are strictly suggesting that only patients that can be want to be treated should go to the clinical trials. So clinical trials are supported, and so they would support clinical trials. Of course, they are very, very costly. So that is a problem. But now in many countries, the cannabis is released from legislation, strict legislation in prohibition, and so we can hope that in many countries internationally we can achieve some results.
Can you discuss or share any anecdotal or documental experiences from cancer patients who have maybe done some cannabinoid treatment?
Yeah.
Do you have any?
I remember my story, my experience with a lady in Canada. Actually, after we published one first paper on cannabis, and we have there made a specific application on glioblastoma survival. I got a call from Canada, so it was interesting how patients that have no higher education or specialist, they would understand, and they asked me if I can suggest therapy for her daughter, who was only 24 years old. And this daughter, her name was Susanna, was really taking this, and now it's the 4th year after glioblastoma highest grade that she is stable. Tumor is not growing, actually diminished, and she's probably being well in a couple of years from now, so the tumor will disappear, we hope.
Can you share the formulation that you used for this patient and why this formulation specifically was so effective?
Yes, I actually can, because it was published, so it's published formulation, so it's no secret. And this is a combination of CBD and CBG, cannabidiol, which is in combination more effective than if they were alone, or even if we add THC, it's no difference. So only this is great, especially for glioblastoma patients, where THC is not welcome because of the different side effects. So this is because it targets, this combination targets the stem cells, cancer stem cells. And these cells are the initiator of the whole tumor. And if you kill them, then you destroy the tumor as well, or prevent further growth. And in fact, these stem cells are most very, very resistant towards chemotherapy and towards radiation, but not towards cannabinoids, which in contrast to what these other drugs are. So this is very important, because we now know also the second paper we showed that this is because of certain receptor on stem cells, cancer stem cells, that are not present in the mature tumor cells. And there's a whole now also confirmation in literature that this hypothesis is right. And so I'm looking forward for further research in this field. And of course, this is for glioblastoma.
Thank you very much for this conversation.
Thank you.
Hope to host you again.
Thank you.